Good afternoon, Mr. Daniels. I am Dr. Walker. What brings you into my office today?
Good afternoon, doctor. You can call me Jack. I'm here because I have been having these random jerky movements for over a month and I can't make them stop.
If you prefer first names, you can call me Dr. Johnny. Stand up for me, Jack. Can you describe these uncontrollable movements to me?
Well, you see, Doc, they are sudden and jerky, mostly in my hands.
Are you experiencing any other symptoms?
Yes, sometimes my tongue moves real fast, Doc, and my friends say that I've been making these weird facial expressions.
I would like to perform a thorough assessment on you. Have a seat, Jack. I'm going to check your reflexes. First, I'm going to tap your knee with this hammer. It should not hurt.
Okay, Dr. Johnny.
Jack, do you have any family members who have experienced anything similar?
Not that I am aware of, Dr. Johnny.
Do you have any family history of mental illness?
Yes, my uncle kind of went crazy.
What do you mean when you say he went crazy?
He got a divorce and became a recluse, then he killed himself.
I would like to run a few more tests before I make a diagnosis. Would you allow me to discuss your case with my students?
Absolutely.
Let's discuss case study 13. Here we have a 43-year-old man who came to his physician complaining of uncontrollable movements which he had for over a month. The patient often made sudden jerky movements with his hands and displayed facial grimacing and rapid tongue movements. The examination revealed increased deep tendon reflexes. Family history revealed that the man had an uncle who at the age of 50 divorced his wife, became a recluse, and shortly thereafter committed suicide. Who would like to classify this type of involuntary movement? Tequila, please come explain your answer.
The rapid jerky movements described are consistent with choreiform movements, also called chorea. Chorea is involuntary purposeless movement that can be classified as hyperkinetic. It is sometimes described as dance-like because the movements appear to flow from one muscle group to another.
Tequila made me want to dance, but that is correct. The movements are hyperkinetic, specifically chorea. I need someone to explain the diagnosis, pathogenesis, and prognosis. Any takers? Evan Williams, you're up.
The diagnosis for this patient is Huntington's disease. It is a genetic disorder with an autosomal dominant inheritance pattern. It is caused by a mutation in the Huntington gene, which is located on chromosome 4. The type of mutation is an unstable triplet repeat. Patients with Huntington's disease have 42 to greater than 66 repeats in the Huntington gene, while the normal gene only contains 15 to 34 repeats. HD can also present as mental illness. Patients might experience alterations in mood or personality, such as depression, irritability, paranoia, and impulsive or eccentric behavior. Patients might also experience deficits in memory or attention. Huntington's disease currently has no cure. Symptoms progressively worsen and patients die within 10 to 20 years. Treatment of symptoms can decrease patient suffering, but this requires multiple medications, which often have severe side effects. Additionally, the medications must be changed frequently as the disease progresses. The prognosis is poor.
Evan Williams has made us all very sad, but that explanation was very good. This patient is suffering from Huntington's disease, which is caused by a mutation in the Huntington gene that is inherited in an autosomal dominant pattern. Lastly, the prognosis is poor. Who would like to describe the neurotransmitter imbalance seen here, and the pathways involved? Chardonnay, Can you come explain?
This image shows the disturbance in the indirect pathway within the basal ganglia in Huntington's disease. As you can see here, the projection from the caudate and putamen to the external segment of the globus pallidus is diminished. This causes an increase in the tonic inhibition of the subthalamic nucleus, which decreases the excitatory activation of the internal segment of the globus pallidus. This decreases the ability to oppose the action of the direct pathway within the basal ganglia. The overall result is an increase in thalamic excitation of the cortex, which results in increased and inappropriate motor activity. In Huntington's disease, the medium spiny neurons that project to the external segment of the globus pallidus degenerate. Without the normal inhibitory input from these neurons, there is an increase in the activity of the external globus pallidus cells. This activity causes a decrease in the excitatory output of the subthalamic nucleus to the internal segment of the globus pallidus and decreases the inhibitory outflow of the basal ganglia. Because of this decreased inhibition, inappropriate signals can activate the upper motor neurons. This inappropriate activation causes the undesired choreiform movements in Huntington's disease. To review, the overall result of the degeneration of the medium spiny neurons that project to the external segment of the globus pallidus is a decrease in tonic inhibition and, thus, an increase in the thalamic excitation of the cortex. Degeneration of neurons causes severe atrophy in the caudate nuclei and less severe atrophy in the cerebral cortex. As you can see here, the size of the caudate and putamen, which comprise the corpus striatum, are greatly reduced in patients with Huntington's disease. Early in Huntington's disease, there is a decrease in GABA due to the degeneration of GABAergic neurons. After disease progression, there is also loss of acetylcholine as cholinergic neurons degenerate.
Excellent description, even though Chardonnay gave us all a headache. In Huntington's disease, there is damage to the indirect pathway within the basal ganglia. There is an early decrease in GABA and a later decrease in acetylcholine. Now, we should all have a good understanding of Huntington's disease.